Well, good afternoon, and thank you for joining us this afternoon for our weekly press updates for COVID-19 pandemic. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco. Before we get going, I always want to invite you to remember that we will be doing a full Spanish translation this afternoon and airing that whole press conference this afternoon at 4:30. We're also doing American Sign Language, but always so gracious to be a part of our opening part of our press conference is Mayor Pro Tem Hector Sabito to speak to our Hispanic audience and invite them to our viewing this afternoon at 4:30. Hector, would you please express our invitation?
Absolutely. Good afternoon, everyone. Buenas tardes. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en vivo en español durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again for the invitation.
Thank you, sir, for always being part of it. The important part in making sure everybody knows we are providing these opportunities. Joining me today again, always, is our host, our Waco Mayor Dylan Meek, and our Mclennan County Judge Scott Felton. Today we're having a little bit of different mix. In addition to Dr. Jackson Griggs, CEO of Family Health Center, we're going to enjoy hearing from an independent. We have Dr. Tim Martindale, who is an independent family physician. And we're hoping to maybe have Dr. Mark Allyson from Baylor Scott & White get on. He's having a little difficulty, or we are, either one. They may have to get that. We're going to get some great information from that. So I'd like to start with opening information or opening comments. We'll start with the mayor, followed by Judge Felton, Dr. Griggs, Dr. Martindale, and then hopefully we'll have Dr. Allyson on. So, Mayor, take it away.
Good afternoon. I want to just thank everybody for taking time to join us today, and thanks for all the individuals on this call. I know that everybody's busy, and your willingness to communicate to our community is outstanding, and we are working really hard to make sure that our community is informed on all of the different things happening related to COVID going on. I announced a shift last week in format, starting today with showcasing some new doctors and other healthcare experts in lieu of only hearing from the hospital system's chief medical officers. And today we welcome back Dr. Mark Allyson. Hopefully, I think we're having some technical difficulties, and we'll also have Dr. Martindale joining us today, as Larry mentioned. So welcome to the panel today, gentlemen. And Dr. Griggs is going to report shortly that our numbers are on the right track, and that's positive news. But still, our local hospital systems, our city staff, our county judge, and myself are in close, regular contact with one another as we discuss and monitor data regarding hospital capacity, hospital personnel issues, and monitor whether or not our emergency management office will need an alternative care site. And it seems like, given where our data is trending, we will likely avoid that hardship of standing up an alternative care site. We're obviously not out of the woods yet, but it looks like we're headed in a positive direction on that. Our local doctors continue to advise us of the seriousness of this virus, even though we are seeing vaccinations in our community and in more positive numbers. But I urge the community to continue to take this seriously by listening to the wise doctors on this call and following their protocol by wearing masks, practicing safe distancing, and washing our hands. These good doctor-endorsed protocols make the situation not fearful. As a reminder, at the present time, Texas mayors and local governments have almost no policy-making authority. I know I say this every week, but I'm always surprised at people who still believe that the city or the county might have a level of policy-making or regulatory control that we simply don't. Governor Abbott has implemented and has control of regulations and mandate, from wearing masks to closures of bars to the occupancy requirements of our facilities. The governor has issued an order stating that we can't issue more restrictive orders than him, and we have not heard any word from the governor's office that this might change. Brief update on testing. I did just get a text message right before this press conference that said, let me pull that up here, that the Texas Department of Emergency Management has closed all outdoor testing sites due to the expected freezing weather this week. The drive-through testing site at the MCC campus will be closed today through next Tuesday and will reopen next Wednesday. The walk-up site at the City of Waco Multipurpose Center is an indoor site and will remain open. If you have made an appointment for the MCC site, the testing vendor will contact you to reschedule your appointment. So that is an update on testing. As always, you can go to covidwaco.com for more information on the free testing that is available in this community. And I know that our city staff will be updating covidwaco.com with this information. The Waco Mclennan County Emergency Management Office previously received a refrigerated truck to be used as a temporary morgue. Currently, we have 16 remains on that refrigerated truck. And now on to vaccinations. It is good news in Mclennan County that residents are getting vaccinated. That is real truth, and we are very thankful that the day for vaccines has come. It's an answer to a personal prayer of mine. But I know that it has been difficult for many because the number of vaccinations that we're getting in Mclennan County is greatly outweighed by the demand for vaccinations. As a reminder, there are many local organizations who are giving vaccines. We call these vaccine providers or just providers. A list of these providers is on our website at covidwaco.com, and it includes CVS and HEB, Berkshire Brothers, Baylor Scott & White, Providence. One of the many vaccine providers in Mclennan County is our public health district. As a reminder, local government has no authority or control over other vaccine providers. Our health district has worked to partner with the providers and establish best practices when they're willing. We've tried to collaborate with the different providers in this community and tried to be a resource to them, but each provider has a contractual relationship with the state, and vaccine providers are required to distribute vaccines per their arrangements with the state, not with the city or the county. I am thankful for our vaccine providers in Mclennan County who are all working hard and diligently to distribute vaccines equitably here in Mclennan County. And now for an update on the Waco Mclennan County Public Health District's vaccination clinic. We are in week 5 of our hub vaccination clinic. This week, the Waco Mclennan County Public Health District has received another 1,500 first doses and 1,500 second doses from the Texas Department of State Health Services. To vaccinate 3,000 people in 3 days, we've increased our number of appointments from 98 per hour to 138 per hour and expanded the clinic hours to Thursday through Sunday from 9 a.m. to 5 p.m. at the Waco Convention Center. If you received your first shot the week of January 11th, you will get a call and an email this week to schedule your appointment for your second dose. As of this morning, 1,400 of the second dose appointments have been scheduled. We've heard many positive reviews for how our clinic itself is organized, how well it's organized, and how smooth the process has been for those once they've been able to get to our vaccination clinic. But I very much understand the pain point that has come from the registration process, and that some residents have expressed significant frustration over the difficulty of reaching to our call center. And I just want you to know that we have heard that. We're doing everything we can to bring a resolution to this. The call center is available Monday through Wednesday from 8 a.m. to 9 p.m., Thursday and Friday from 8 a.m. to 5 p.m., and on Saturday during our clinic hours. Our call center staff is working diligently to take calls, to answer questions, and to make appointments. In the past 2 weeks, we have received over 9,100 calls to the call center. That's an average of about 700 calls per day. However, on registration days, those numbers have gotten as high as 1,385 calls per day. And there have been some instances in which callers heard a busy signal or were unable to get through. To alleviate the access issue, we continue to add city staff to our call center and to support the vaccine registration efforts and COVID-19 information line. We have doubled staffing from 10 to 20 call-in takers during the normal Monday through Friday, 8 a.m. to 5 p.m., and have 15 operators working evenings Monday through Wednesday. The call center is staffed with 6 employees on Saturday to help fill cancellation and no-show appointments on the last day of the clinic. We will continue to supplement staffing with part-time employees as they are available, and are in the process of adding a second call center location to support additional employees with appropriate distancing and COVID-19 precautions. Many of the calls this week contributing to the high call volume have been regarding second dose questions. So staff has added a menu to the call line to attempt to address these questions prior to accessing the call operator. The call center software is being upgraded to improve the client experience. The phones and the computers are being upgraded to improve efficiencies within the call center. And we are improving the notification system to add text message capabilities to our customers on the wait list. If someone wants to confirm that they are on the wait list, they can call the call center at 254-750-1890, and one of the operators can confirm registration. However, our operators are not able to tell you whether or not you have a place on the wait list or estimate when you may be contacted for a clinic visit. We are expecting bad weather and freezing conditions this week. The vaccine clinic is fully indoors and is planned to take place as scheduled. Please travel safely. Your appointment will not be canceled if you are late. If you are unable to make your appointment, please contact the call center to reschedule. We will not remove anyone from the wait list because they are unable to get their appointment. I know this process has proven difficult. We have more than 30,000 names on our waiting list, and we are only getting 1,500 first doses of the vaccine to our health district each week. We have put together and assembled a task force of local leadership to try to procure more vaccines and make sure that we are putting our best foot forward to the state, showing them our capacity at the public health district, our wait list, and the need here in Mclennan County, so that when state leaders are deciding how to distribute vaccinations, they know that there's a great need and an ability to receive those vaccines here in Mclennan County. There's also a Equitable Vaccine Allocation Subcommittee that is convened for the first time today. And it's a group of stakeholders from throughout the community dedicated to making sure that our most marginalized and vulnerable neighbors are getting access to this vaccine. Communications regarding the vaccine and COVID in general are and will continue to be challenging, but we are making progress on distributing vaccinations to our community, and your patience is appreciated. We take this very seriously. I want every member of this community to know that if you are in the 1B and 1A category, I'm doing everything I can. Our city leadership is doing everything. Our county leaders are doing everything they can to make sure that our hub is a place for you to get that vaccine. We will continue to communicate as best as we can through our weekly update emails, our website, this press conference, social media, town halls, and coordinated messaging and outreach to neighborhood associations, local faith communities, local businesses, grassroots organizers, and other local nonprofits, with a focus on ensuring vulnerable populations are given fair and equitable access to these vaccinations. So again, I know that this has been a challenging process because the demand for vaccinations is great and our supply is low. We are going to continue to improve our systems through our public health district. I'm proud of the work that we've done to date, but believe that and know that we can always get better, and we're working towards that every day. So thank you, and with that, I'll hand it back to you, Larry.
Okay, thank you. Great information. Thank you, sir. Let's go now to Mclennan County Judge Scott Felton. Judge Felton?
Good afternoon, everyone. Some of what I'm going to say to you here may be a duplication of what Mayor Meek has said, but most of them are important points that you might not have caught. So as of today, the health district has vaccinated 7,000 people. And the Department of State Health Services website reports that 21,012 people in Mclennan County residents have received their first dose, and 4,842 have received both doses. As mentioned before, the other providers are important part of our supply of vaccine, and they make up that difference between the 7,000 and the 21,000 vaccinations that have come into Mclennan County. 17 long-term care facilities in Mclennan County are part of a federal vaccination program. at least 2 facilities have completed vaccinations for their staff and residents. And most of the others are well into getting their staff and residents vaccinated as we go forward. The Department of State Health Services has provided guidance to all vaccine providers to ensure an equitable and distribution of vaccine, and particularly to focus on people 75 years of age and older. And we are utilizing a wait list to identify these populations through the Waco Mclennan County Public Health District clinics. 41% of our clients have been 65 to 74 years of age. 32% have been 75 years of age and older. The remaining amount are people that had conditions or first responders or medical people that are working directly with COVID patients. If you have a family member or friend that needs help getting on the web list, please offer to help them register. This is something you can do and be a personal volunteer to this effort, and by helping your friends and relatives do this. I know in my family there's several of my nieces and nephews that have been involved in that, and they're able to help quite a few people. There's a lot of challenges, as Mayor Meek mentioned, and going through getting on the wait list. And again, we apologize for that. There's no question about it that our demand outweighs our supply right now. If you have difficulty getting a vaccination clinic, Waco Transit is offering free transportation to the clinic for everyone in Mclennan County. To schedule a ride, call the Waco Transit system at least 24 hours in advance. That number is 254-750-1620. That's Waco Transit System, 750-1620. This afternoon, Mclennan County Vaccine Planning Coalition held its first Equitable Vaccine Allocation Subcommittee meeting. This group is made up of stakeholders from throughout the community, dedicated to making sure that the most marginalized and vulnerable neighbors get access to vaccines. This group will work with the preparedness staff to help us identify new methods and locations for distributing vaccine, and increased allocations are made available as they're made available from the state. A quick update on testing sites. The Texas Department of Emergency Management has closed all outdoor testing sites due to the expected weather. As Mayor Meek mentioned a while ago, the drive-through testing site at MCC campus will be closed today through next Tuesday, and will reopen on Wednesday. The walk-up site at the City Waco Multipurpose Center, which is an indoor facility, will remain open. If you made an appointment for the MCC site, they will hold your appointment until they're open again. Thank you for all the folks that call in or listen in and share this information with your neighbors. And again, you can be a volunteer in a lot of ways in helping your friends and relatives access vaccine. Thank you.
Thank you, Judge Felton. Let's go to Dr. Jackson Griggs, CEO of Family Health Center. Dr. Griggs?
Thank you, Larry, and thank you, Mayor and Judge. Good to see you all again. So jumping right into the numbers, the number of confirmed cases in Mclennan County to date is 24,112, 641 of which are currently active. As of this afternoon, the Public Health District has received notice of an additional 159 new cases of coronavirus. 71 people are currently hospitalized with COVID-19 at both Baylor Scott and White Hillcrest and Ascension Providence. 18 of those patients hospitalized with COVID-19 are currently receiving ventilator support. And we have one additional death to report. That brings our total death count to date to 389 in Mclennan County. Within elder care facilities in our county, currently there are 9 facility outbreaks. There are 12 active cases among patients and staff in these facilities, and there have been 124 fatalities that are nursing home associated. At the county jail, there are currently 21 active cases. There are no current church clusters identified within Mclennan County. There are 12 independent school districts and 1 private school that are reporting cases on campuses. There are a total of 36 school campuses with active cases, and within schools, there are 76 active individual cases. 54 of those are students and 22 are staff. We transition now to my slides, and I'll share kind of where we are in terms of our incidents. And as you'll remember, these are numbers that are new cases per day per 100,000 in population, so we can compare our own population with the state and nation. And what you see here is that Mclennan County is at 15 new cases per day per 100,000. Last week we were at 17, so even down a little bit further from last week, with 36 new cases per day per 100,000 in the nation and 45 in the state. So where does that put us in the strata that were designed by Harvard Global Health Institute? Still in the accelerated spread strata, but moving towards community spread. And so what I think is, what I'm thinking right now when I see this is, I hope we don't get sort of stuck in the doldrums that we were in late summer and fall, which set us up for the big spike in late October. But if we can continue to push this number down and get into community spread, which the next slide will kind of illuminate how we might do that. And that is by, I think, continuing to really push testing, which has dropped off quite a bit. I think as people have had less symptoms and haven't had the same number of exposures, I think that there's a tendency to not get tested as often. And as I've said in the past several weeks, I'll just continue to maybe be a little bit of a broken record here and encourage our community to get tested. If you think you might have been exposed, or if you have minor symptoms that you think could possibly suggest COVID-19, please get tested. We need to see our testing numbers continue to climb so we can get our positivity rate down. It continues to be a really good metric of how how well we're identifying the virus in our community. So the more testing would drive the positivity rate down and really lead us towards a place where we could actually suppress this virus in our community. Obviously, that is not that's not the only strategy. We also have to continue to mask and socially distance and avoid crowds and clusters and use good hand hygiene. I think that we face a temptation to kind of want to relax, but now is the time to, I think, really lean in to those measures that we've been talking about from the beginning, so that while we're getting our community vaccinated, we can continue to see hospitalizations and fatalities decline. I mean, we just have to all remember that this is a team sport. We've all got to work together to keep driving our numbers down. None of us can do it on our own. So here's a slide that just demonstrates ongoing decrease in hospitalization, which is obviously very, very good news. And the decrease in hospitalization will just be a step or two ahead of the decrease in fatality rate. Here we are in our numbers of deaths by month. You see in February, we've had 19 deaths to date. And if we're about a third of the way through the month. So if you multiply that by 3, obviously see that we are going to be have fewer fatalities than in January, and I think that next week or the week after, we'll even see the rate of fatalities begin to drop off, since we've seen the decrease in incidence and the decrease in hospitalization. I think towards the end of the month, the rate of fatalities will also continue to drop off more sharply. Just since I spoke about the emerging variants last week, just a quick update here. The B117, the UK variant that started in Kent, this is last week and this week, number of cases that have been identified in the United States has climbed. The number of states has gone from 33 to 34. So we still continue to see this variant increasing in the United States. The B1351 variant, which is the South African variant that you'll remember has shown some potential resistance to vaccine activity. We've seen, or vaccine effectiveness. We've seen some increase in the number of cases, and it's now in 3 states instead of 2. And the Brazilian variant, the P1 variant, one more identified case in a separate state. So we'll the CDC updates these on a regular basis, and we'll kind of keep watch on these and on the literature that's coming out that's trying to track these variants and their behavior. There are a few kind of minor variants that have been identified, but it's too early to tell whether any additional variants have any real clinical significance. I wanted to address vaccination timing because I think there's a growing number of questions in the community about the timing, and there's kind of a sense right now of worry about the timing, particularly of the second dose among those who have received their first dose. So let me just share a little bit of context that might help ease some of that anxiety. First, the dosing schedule. As you know, the Pfizer dose, there's a 3-week interval between the first and second dose that's recommended. And the Moderna, there's a 4-week interval between first and second. And the CDC, the ACIP of the CDC that makes recommendations on vaccination practices says that there's a grace period of up to 4 days before that second dose occurs. So you get it a little earlier than 3 or 4 weeks for Pfizer and Moderna respectively. And the CDC says up to 6 weeks or 42 days after, I'm sorry, this is after recommended interval. That's really a misprint there. It should say after the first dose. So up to 6 weeks or 42 days after the first dose, if it's not feasible to adhere to the recommended interval. And that's because in phase 3 trials, that's the time period that they were able to track patients and demonstrate effectiveness. So up to 6 weeks after the recommended, after the first dose. But you may have heard that in at the end of December, the United Kingdom announced that second doses should be given towards the end of 12 weeks. So they took a strategy of let's get first doses out to as many people as possible, and we're gonna, in an effort to do that, we're going to extend that second dose up to 12 weeks. And there was some preliminary data at the time that was suggesting this, and now we have sort of some natural experiments both in the UK and in Israel that suggests that that even after 1 dose, the likelihood of symptomatic infection is dramatically reduced. So 50 to 89%, in fact, reduction in the likelihood of getting a symptomatic infection. But a couple of caveats there. One is with 1 shot, the duration of immunity is unclear. And if a one-shot strategy were implemented at a large scale, and that second shot didn't occur, then there is some risk that among those individuals who are partially immunized, it would allow an environment for virus to mutate to that particular vaccine and increase the likelihood of an emergence of a vaccine-resistant virus. So it's not it's not a great strategy long-term for a one shot on the mRNA viruses that we have available to us. But it's also noteworthy to point out that there was one study that suggested that extending the interval between first and second dose increased the effectiveness of the shot. Of course, it would be way too early to use this one study as justification for extending beyond the CDC recommendations of those 42 days. But I do share this. I'm putting all of this in context to try to provide this kind of take-home message that if you are scheduled 3.5 or 4 weeks out for the Pfizer vaccine, or if you had your first shot of Moderna and you're having to wait 5 or even 6 weeks out, I don't feel like there's any need to be alarmed or concerned, because there's ample data to suggest that there's not an increased risk to you as an individual or increased risk to the community if you don't hit that exact 3 and 4 week marker. So I just have heard a kind of growing sense of concern about, well, I'm waiting for that callback, or I've got a few days of delay, or even a week or two delay. What should I do? And I think that my message is be at peace. The second dose is still going to work. You don't have to worry about a little delay here and there. So that's the last of the slides that I had to share. But in my remaining time, you've heard me remark about the great clinical leadership that Dr. Lyson shows at Baylor Scott and White Hillcrest, and I'm so glad to have him back, because there's just it's hard to find a better hospitalist anywhere than Dr. Lyson. So I'm glad he's back. And welcome to Dr. Martindale. Dr. Martindale's a family doctor who graduated from the Waco Family Medicine residency more than just a little over 20 years ago, I think, in '99. And before then, he was in medical school in Galveston. But Dr. Martindale has had a number of leadership roles in the hospital setting and in the medical society. He was our president and did a tremendous job leading the medical society. And then also he serves as sort of a leader in terms of humanism and compassion for the medical community. In fact, if you're interested, he had an article in the Texas Medical Association magazine about his own experience of COVID-19 and how it just deepened his compassion for his own patients. A really nice article about Dr. Martindale. So I'm glad that he's here as well today. So welcome, Dr. Martindale. That's all I have.
Thank you, Dr. Griggs. And after that, a great introduction. Let's hear from Dr. Tim Martindale.
Back at you, Dr. Griggs. I have known him for all these years and think so highly. You've seen his work. You've seen his precise knowledge and communication. You don't see as much the degree of compassion and the degree of quality that you get both from Dr. Griggs and the whole organization he represents, the Family Health Center. Family Health Center serves 40,000 patients or more with several score of doctors. These doctors that are in Waco at the Family Health Center are in the top in the country. It's not like they're working here because they're not somewhere else. Instead, it's the opposite. They trained here, they stayed here. The quality you get for medical care in Waco at the Family Health Center is right what you get at the top spots in the whole country. So it's amazing what they do, the service that they do, the kindness they have, and especially the compassion that's there combined with the quality. So I'm very much a support of what they do, and I'm grateful. I am representing your average doc out there in the community. I'm a family physician. I did get COVID in April. It knocked me down for a month. It was life-threatening. I didn't almost make it. I made it. Many of you saw as I expressed what I was going through during the time in media as well. And from that time on, we've worked hard to help with COVID, starting in May. And so we've been testing every day, diagnosing people every day, examining people in the parking lot every day, since that time, including today. And we will again in the cold this afternoon. It's what we do. And that's happening all across the city. Your doctors that are not in the hospital, who are doing such incredible, amazing, sacrificial, scary work. There's plenty of docs out in the community as well who are on the ground working with people, helping, coaching, teaching, working, answering questions all the time. So that's happening, and it's not a light thing. We have to change our whole technology to do telemedicine with many people. Many people that have health concerns, of course, are avoiding going to the doctors. So many doctors and hospitals are struggling with financial losses and just the lesser volume of care that's happening. So that's something to be aware of, that there's a struggle that's there. But the government's helped some with that, which has been good. And of course, the community has been incredibly supportive. So that's been real helpful too. I will remind you that real practical things, COVID prevention, you can really prepare yourself for getting it. If you haven't gotten already, there's a good chance you still will because it's still around. So get good sleep, lose a few pounds, stay exercising, get good nutrition, have friends and a support system, have a faith or values that give you a sense of purpose. If you do those sorts of things and keep yourself managing your medical concerns well, you're going to be set up so you'll do well with COVID. If on the other hand, you're at a low spot in your life and your immune system is low and your medical conditions are out of control, you have a good chance of having serious complications with COVID. And it's not just during the illness, but most of us know that there's post complications of COVID that can last for months. So be aware of that. Treatment. I do this every day, all day long. Treatment we think of some simple supplements. We think of vitamin C, vitamin D. We think of taking some zinc, and we think of taking a baby aspirin. We think of taking good breathing practices. So this is something you should be doing all the time. Do some deep breathing. Take nice deep breaths in through your nose, out through your mouth. Do that several times, 2 or 3 times a day. Do it now when you're not sick. Practice it. Get it settled and ready in your life so that when it comes, you're ready to handle the respiratory attack that's so difficult with COVID. Also, prone breathing. That means laying face down. Do this. It's a nice thing. It can be a time of meditation and relaxing and de-stressing. Take a few minutes where you just breathe. Laying face down, nice, deep, even breathing. That helps to open up your lungs better. So practice that now, but then if you get sick with COVID, do it multiple times a day. And you can certainly talk to your own physician about all the other things that are out there. There's some outpatient infusions that are possible through the hospitals, something we call BAM. It's a monoclonal antibody shot. It has to be done within a few days, preferably within 3 days of starting your symptoms. You get this monoclonal infusion treatment. It's available right now, and it's available several times a day in the hospitals. So if you're interested in that, talk to your primary care doctor or call one of the Providence clinics or one of the other places, the emergency room at Baylor Scott & White, if they have some available. So that is something that can be helpful. Outpatient, this is not inpatient, this is outpatient to help people who have higher risk to get better boosting to help them overcome COVID. In the hospital, there's all kinds of things we can do. Of course, Dr. Eliason can talk much more, but we do remdesivir, we do convalescent serum, we do steroids, we do high flow oxygen. And of course, if it gets worse, we do ventilation. So there's much we can do to fight and beat COVID. Most people get better, although there are some long-term complications that can happen. Vaccines are totally safe. I totally was ready to get it. Now, I had COVID, and I'm aware of the science, and I was ready to be as soon as they called me, because I do COVID work every day. They called me and said, come here because you're getting exposed every day. So I did. There wasn't a question in my mind. No, there's no worry about the fact that it worked quickly. It worked quickly because we worked on it for decades, the technology that's there, because we practiced doing that same vaccine technology with other vaccines, because we had a giant population of people who were sick, so there was no lack of research subjects so we could do this well. And because it was a giant budget and strong effort across the country, similar to what we've happened in rural wars, that came together with an amazing solution and a safe solution to prevent this difficulty of virus and turn our lives around. So it's worth it. You got to get it. There's the Pfizer and there's the Moderna. There's another one that's currently being considered and probably in the next 2 or 3 weeks will be approved, called the Johnson & Johnson. Some have asked, is that something that's worth getting because of the fact that it has a slightly lower efficacy rate? So the other two have the 95% protection. This one had 60 something. In the US, it's actually 72% protection against illness. But more importantly, it's 85% protection against serious hospitalization or death. And they found after as many as several weeks, it had pretty much 100% protection. So the Johnson & Johnson's a great one. It won't have any storage problems because it can be done in a regular fridge. It's a one dose that's there instead. It's incredibly protective. The side effects are less. I think it's going to be a great option for us to have in the next few weeks. I did apply, by the way, as for my clinic, and many others have around town, to be a vaccine dispensing site, and we were approved. The 2 hubs have plenty of vaccines. The rest of us out there that hope to have some just have to wait and see. So I have had none so far. I may get none for weeks. I suspect once the Johnson & Johnson's available, we'll have a little bit more available. So it is not true that there is any concern about DNA changes in your body. It is not true that somebody put any kind of implantable device into your brain to control behavior. This vaccine is safe, it's effective, it works, it will turn this situation around and bring us to a point of safety. I'm with you in this. All of us are with you in this. We believe that we have a future that we're going to overcome what we're dealing with and expecting much better future ahead. Thank you very much.
Thank you so much, Dr. Martindale. Great new information. We've never had some of that on all our weekly press conferences. And I know we've been struggling a little bit with Dr. Mark Eliason, but I think he's on the line now. So Dr. Eliason from Baylor Scott & White,
Yes,
are you there?
Thank you for your patience. So glad to be back.
Good to have you.
Difficult to follow after those wonderful conversations and information, but I do want to share a few things, and we'll just continue this conversation about the vaccines for just a moment. I find them miraculous, and this is something that everyone has been asking and praying for since the very beginning of COVID. This is the cure. This is the only solution we have to wiping out COVID. Without it, we're stuck with our simple prevention measures. And of course, we have a few treatments, but those by and large are not a panacea. The vaccine is the only way we're going to get through this. Many people, even educated people, even people within healthcare who are educated, have some concerns about it. And that's okay to have concerns, but it has been documented and tested and proven to be safe. Most side effects are going to be experienced within, most serious side effects are going to be experienced within a few minutes to a few hours. And so the concern about, well, we don't have long-term safety data is not really a valid concern. The issues that make a vaccine unsafe are going to be experienced very promptly. And we have had months and tens of thousands of people that were studied. And then now we've administered to over 30 million Americans. And the CDC is closely monitoring the vaccine and its efficacy and safety. It is safe. I've received it and was thrilled to be someone who could get it. And I would encourage you, if you haven't already had your vaccine, to get in line and to get it, because not only is it important for you, it's important for our community. By vaccinating people and making people immune to the vaccine or to the virus, that is the only way we're going to return to normalcy and get back to pre-2020 life. Some people will have very minor symptoms. And as Dr. Griggs was talking about, it's important to get tested if you're having some symptoms. Now, some people may even have no symptoms. And so if you've been exposed, it's still wise to be tested. But some people will have even minor symptoms where they may have a stuffy nose or they may have loss of taste and smell only. Some people may never have a fever. Just because you don't have fever doesn't mean you don't have it. So it's important still to get tested, because when you identify that you have the illness, we need to quarantine and prevent the spread. Unfortunately, some people get very, very sick. And I guess the good news is that's a very small percentage. So we're talking about less than 15% of people who will get COVID will have a life-threatening illness that puts them in the hospital. And also, as Dr. Martindale said, the good news is most people who get COVID get better. Most people who end up in the hospital still get better, but not everyone will get better. And, I've been taking care of COVID patients for next month, it'll be a year. And I've taken care of hundreds and hundreds of you in our community, and it's been a great honor. I've also had the misfortune, I guess, of knowing, misfortune's not really the right word, but I've taken care of many people who have also succumbed to its illness. I wanted to share kind of two stories from this week, and of course, I'll leave it very vague, but two individuals who had been dealing with COVID for weeks and who showed signs that maybe they were getting better, and then not quite relapsed, but because they didn't get all the way better, but they had shown some significant improvement before getting sick again. Poster but the two patients in particular this week had been battling this illness, and both
Dr. Lyson, we're having trouble on your end. It's not coming through. We're hearing interruptions. And I think maybe we've lost your image as well. So,
Larry, Dr. Lyson was sharing such great information, so I hate to do this, but why don't we move on to the media portion?
We'll do that, and we'll do that. Let's go to the media portion. We do have two individuals from the local media. We have Rhiannon Sagert from the Waco Tribune-Herald, and I think we have Hannah Hall from KWTX Channel 10. So let's go in that order. And Rhiannon, are you on the line?
Yes, hello.
Go ahead. We hear you. Go ahead and ask your first question.
Please tell me a little bit more about the subcommittee and the task force that you mentioned earlier, more detail on what they'll be doing and how often they'll be meeting and such.
Sure, I'll field that one. And Rhiannon, I can get you some more information on the schedule. So I brought up two different, I guess, subcommittees would be the word for it. One is on vaccination procurement, and basically put an informal group of folks together to really make sure that we're doing all that we can to get vaccines to this community. So our hospital CEOs, our healthcare system CEOs on the call, as well as other local leaders who might have any sort of acumen for the Department of State Health Services, as well as the political climate in Austin and really what the state is looking at when they're determining how to allocate vaccines and ensure that we have a coordinated, consistent, solid presentation that we are given to state leadership to make sure that that they have the data that represents the need in Mclennan County and our ability to distribute vaccines in Mclennan County, and any other information that might help make them a determination to allocate more vaccinations to Mclennan County. So we're doing everything we can to be able to tell our community members that we are trying to get those vaccines for our community. And Judge Felton is on that task force as well. The other task force is a subcommittee to work strategically and think critically about what we're doing and ensuring that our vulnerable populations are having access to the vaccine, that we're communicating appropriately and implementing policies and procedures that make sure that we are being proactive in engaging with communities that are vulnerable as well. And I can get you some supplemental information on some of the work of that subcommittee, Rhiannon, but that's kind of all I have on that at this time.
Okay, thank you, Rhiannon.
Judge Felton, anything you want to add on that? Anything I left out there? You're muted, Judge. Sorry. At least you're not a cat.
Some would argue. It's both groups actually are very strategic and one in trying to see what's going on, making sure that we're getting our share relative to our population and our need regarding the amount of virus that we have in our community. And the other is more strategic in getting the vaccine once it's delivered here into the arms of the people, and be sure that we're covering the whole footprint of our area. And as I mentioned in my conversation, that our demand outweighs our supply, but that we're hopeful that that's going to change, and that we need to really reach out. We have a limited amount of people that are able to physically help us do that, so we've got to be very strategic in planning. And with the providers now being scattered pretty much across the footprint of the county with pharmacies and those things, it's going to help us get out into those areas. The public health district is vaccinated 1/3 of the population, and 2/3 of it has been provided by the other providers. So we're going to watch that, see that there's areas that aren't really, that we maybe didn't focus on as much, and that they need help, and to do both, I guess you kind of almost a marketing or public relations in those communities, and talk about safetiness and, why it makes sense to do it, and then help them get on the line and get vaccinated.
Okay, thank you, Rhiannon. We'll be back to you with another question in a moment. Let's go to Hannah Hall with KWTX Channel 10. Hannah, are you on the line?
Yes, can you hear me?
We sure do. Go ahead.
First thing, Mayor Meek, if we could also get the information about the subcommittees as well, that would be great.
Sure.
And then in regards to my question, have you all had, at the health district or any of the other hubs, had issues with people missing their vaccine appointments? And then if people do miss it, how do you all address that? Since I know, of course, the vaccine has to be given within a certain amount of time.
Yep. I'm going to let Kelly Crane respond to that one. Hey, Kelly.
Hi. We do have occasional people that have to cancel their appointment for a variety of reasons. Or they're just not able to show up. We don't remove anyone from the wait list if they're not able to show up for their appointment. And we try to call them back or ask them to call us and reschedule. So that's how we're handling it. We're not having a large volume of people that have to cancel. Most of our cancellations are because they found the vaccine elsewhere. So we're trying not to let anyone slip through, and we do reach out to everyone that's not able to make their appointment.
And Kelly, one thing that, if you don't mind, back me up here, or clarify this, but we are planning for those cancellations in our process to ensure that we don't have any vaccine that doesn't go to our 1B and 1A candidates that have signed up to the wait list. So we're expecting those cancellations to occur for when they do. Is that right?
Absolutely, that's correct. Every clinic day, our staff reassesses on the number of cancellations that we've had thus far, and we start making phone calls. Can you arrive today? Can you come today? And we just work through the wait list, asking people to arrive so that we don't waste any doses. We do that for our no-shows and cancellations, but also because we're able to occasionally get extra doses. We're averaging about 100 extra doses per 1,500 doses that we get, and we don't want any of that to go to waste. So we spend a lot of time working the phones on clinic days, making sure everyone is covered.
Thanks, Kelly. Okay,
Hannah, thank you. Let's move back to Rhiannon. You have another question, Rhiannon? Rhiannon, you on the line?
I don't have a second one. Thank you.
Okay, thank you for participating today. Let's go back to Hannah. You have another one, Hannah Hall?
I do. I don't know if anybody will be able to answer this since nobody from Ascension Providence is on the line. But we were curious about, we know that Ascension Providence had shared a lot of their doses, or not necessarily a lot, but shared their doses in the community. And then when the state sends the second round of doses for the second vaccine, is Ascension Providence then sharing that with those organizations who they gave the first doses to, or how exactly is that process working?
I think you're exactly right, Hannah. Since no one from Ascension Providence is on the call today, I don't have that information. Does anyone else on the call? If no one else has that, then I think you might be right, Hannah, that we don't.
You know, I could speak to it, I think, Hannah, to some extent, and that is that Ascension Providence was very generous to the Family Health Center in maybe the second week of January, and gave us the portion of the vaccines that they had been provided that week, and then this week we're scheduled to receive likely tomorrow or Friday, we'll receive another portion of their weekly shipment, and so we will be getting those into arms Friday, and I think we'll probably need to continue over the weekend to get those in arms. But in terms of your question about the second dose, yes, that Ascension has assured us that as they get second doses, then they will share with us according to the same numbers as the first dose that were, so 1-to-1, you know, the first dose provided to us, they'll share with us a dose for the second dose. And so we're looking forward to that. I think that it's a good example of just the collaborations that are emerging in the community in this moment. I can't imagine what it'd be like to be in Dallas or Houston or some other monster city where we don't have these relationships and can't have and aren't able to have these kind of conversations where we can work together and make sure the vaccines get distributed well in our community. So hopefully that answers your question.
And I do have to say that DSHS has really responded to their commitment, kept their commitment. Our first second dose round is this week, and they honor that commitment by providing us enough vaccine to reach that group. So they're doing a great job of honoring their commitment to us.
Great, thank you.
Thank you, Hannah. Thank you, Rihanna, for both being on our media part now. And I'm glad to see that Dr. Lyson is back on. Dr. Lyson, you were starting a very passionate story. I'd like you to go ahead and start over and do that again, because I think the public needs to hear it, because
I thought I was being censored because I got an error message through Zoom that kicked me out. So, and I'll make this brief, but in short, you know, I had two patients who were enduring for many weeks the difficulties of a serious COVID illness, and at first looked like they were going to recover and be fine, and then it became quite evident to both of them, as well as to the medical team, that they weren't going to survive this illness, and that often happens. But what made this so unique was that these two individuals came to that conclusion themselves and requested that we stop being so aggressive and trying to cure them when it was obvious that there wasn't. And oftentimes we hit that wall, that roadblock, and we don't want to give up. But these two valiant men were willing to accept that, and that was difficult for a lot of reasons. One of these men had no previous medical history, but was terminal. And I do want to highlight what Dr. Martindale said, that, you know, taking care of your health, whether that means mental health, physical health, is incredibly important. And as I've mentioned, I've seen hundreds of patients with COVID in the hospital, and very few, not all, but very few will succumb and pass from this illness who do not have medical problems or who are not well. It is not a total passport, right? You're not going to completely for everyone's not going to escape, but the risks become so much less, and the odds are so much more in your favor when you are a healthy individual. And that may mean, again, taking your medications, exercising, eating well, meditating, and having a strong family support or family and friend support group. But again, we can do this, and we have the tools in our hands now, which is social distancing, masks, and medications and a vaccine. So I'll stop there. Thank you, Larry.
Thank you for that. Mayor, I'm going to let you wrap us up, and then I'll make a few closing comments, and if you will, we'll go with you.
Just to reiterate, because I don't know if I said this correctly, you can call to confirm you're registered on the health district's vaccination clinic wait list. I'm not sure if I said that clearly, but you can call our the numbers we've given and that are available on our website. Just let me pull that up really quick just to make sure I say the right one. It is 254-750-1890. So if you call that number, you can confirm you're registered. Okay, the last thing I want to say is it's Black History Month, and one of my co-council members, Andrea Bearfield, ended our last council meeting with a quote of Jules Bledsoe, who's one of the many world-renowned African-Americans who are from Waco. And the quote is this: "In order to not pass out of this world forgotten in a few years, do some unselfish good. It does not take genius or fame or fortune. All it requires is a good heart and a kindly spirit." And I thought that was a great quote to end today on. So I want to end with that encouragement for Wacoans to take good heart, to carry a kindly spirit as we go forward this week, and to end with the assurance that our city, our county, and your community leaders are doing everything they can to beat this virus and to serve our community residents well and with excellence. And I'll end with that today. Thanks, Larry.
Well, thank you, Mayor, and thank all of you who participated on our panel today. Great information, and I know our citizens appreciate that. And I do want to remind everybody that we will have a full replay in Spanish this afternoon at 4:30 right here on this same channel. And it's 7 o'clock tonight on our channel as well, but it's always both versions, English and Spanish, are both available on our website at wccc.tv. Not any mention about the flu vaccine, but we certainly want to encourage that, I'm sure, because the flu is still active in the season we're dealing with. And always you can go to covidwaco.com for the very latest information on vaccines. And getting tested, I think, is still a very critical thing that we want to encourage. So, and that testing information is available on that website as well. So if you have not gotten on the wait list and you are in the 1A and 1B categories, you can go to the covidwaco.com, look for the big red button, and you can sign up right there, and you will be contacted in the future for the Waco Public Health District. And if you do get a phone call from a 750 phone number, please answer it, because that's the health district most likely trying to call you. We know a lot of people screen their calls or block their calls. We're trying to call you to either schedule a call shot for you, or maybe your second dose, so watch for that. That's going to be wrapping it up for our press conference today. I hope you've benefited from that. Share it with people who maybe don't have the benefit of this. We do have a line for people who do not have who do not have email or internet. You can get the updates on information that's on the COVID Waco main site at 750-5606 in either English or Spanish. So that's another way we're trying to communicate what's going on out there for people who don't have all the technology. That's going to wrap us up for this time. We hope you appreciate this, and we'll see you next time, and have a nice day.